Hi, my name is Josh Fischer. I'm one of the internists here at Coastal Medical, and today I'm going to talk to you about advanced directives. So 3 basic questions. Number 1, what is an advanced directive? Number 2, why would you want to have an advanced directive? And number 3, how can you make an advanced directive? First question, what is an advanced directive? Very simply, an advanced directive is a statement about what kind of health care you would or would not want to have in the event that you could no longer make decisions for yourself. An advanced directive generally consists of 2 parts. One is what we call a durable healthcare power of attorney, and that's where you designate an agent to speak on your behalf in the event that you became incapacitated. So for example, you might designate that if you were ever in a coma, your daughter would be the person to make your healthcare decisions for you. The second part of an advanced directive is what we call a living will, and here you get to specify some specific instructions about things you would or would not want done in the event that you were very sick. For example, you might have a statement in your living will which says something like, if you were ever severely demented and as a result could no longer eat, you would not want to have a feeding tube placed to artificially prolong your life. Second question, why would you want to have an advanced directive? There's really 2 reasons. The first is for yourself. It gives you some control over what would happen to you in the event that you became very sick and could no longer make your healthcare decisions. The second reason to have an advanced directive is really for your family. There can be a tremendous burden of guilt for loved ones who have to make decisions about end-of-life care for a relative or a good friend. And this really takes that burden of guilt off of them. The third question is, how can you make an advanced directive? And it really couldn't be simpler. You go to the State of Rhode Island's website, which is shown on the screen, and you download this Durable Power of Attorney for Healthcare Advanced Directive form. It's free. It takes only a couple of minutes to fill out, and then you get it notarized, give a copy to your doctor and a copy to your relatives. If you have any questions or concerns about how to fill this out, your coastal doctor will be more than happy to go through it with you and help you with that process. And the fact is, most of us don't like to think about our death, and it's very understandable that many people put off making an advanced directive. But really, in the same way that most of us make a regular will or buy life insurance to make sure our loved ones will be taken care of if something unexpected happens to us, this really is an important thing that everybody should do at some point.